It's 3 o'clock. A very good afternoon to you and welcome to eNCA. I'm Nqobile Madlala.
And I'm Nqobile. Pleasure to be in your company this hour.
Let's get going. Nehawu is again taking on government over the safety of health workers during the COVID-19 pandemic, this time threatening a national stay-away next month if the union's concerns are not addressed. It's conducted an assessment of the supply of personal protective equipment as well as compliance with occupational safety laws at hospitals in the country's coronavirus hotspots. The union has announced some of those findings at a briefing held earlier today. eNCA's Nqobile Madlala was there and joins us live now from the newsroom. So Nqobile, let's begin then with just what Nehawu found when it visited these various hospitals in the hotspots.
A lot really, Tembegile, but just to highlight some of the most important ones that they were really fuming about was one of them is that they felt that there was an abuse of power, saying that a lot of health workers were forced to work under very bad conditions, but also at the same time they were sort of blackmailed to not speak about the sort of conditions that they are faced with. They were told to basically carry on as however way they are expected to be. And also at the same time, the union just said that they also noted that there wasn't enough PPE for health workers and also major one, shortage of staff. Now we have heard this from the president himself saying that there is a staff shortage. So also Nehawu just saying that a lot of nurses are expected, health workers are expected to work at this point longer hours and sort of stretch the services because there isn't enough staffs. But let's just listen on.
In all health institutions that were visited by our teams, the shortage of staff was one of the primary factors that were raised, not only by workers but also by some managers as well. Our own experiences, which were confirmed by these site visits, is that these shortages do not just involve the categories such as specialists, doctors, allied professionals and nurses, but all different non-clinical staff as well. This generates an unbearable environment and experiences for patients and visitors. Not to mention the extreme work overload imposed upon to the current workforce in the face of the COVID-19. Resultantly, the public health institutions are chronically suffering from unsanitary conditions, long queues, exhausted and irritable for workforce, amongst other negative factors. In fact, the question of shortage of staff is so pervasive across public health institutions that we visited, and in other hospitals, our teams found that nurses are being forced to do work of cleaners and porters without necessary designated PPEs.
Nqobile, still at that briefing, Nehawu was giving an example, for example, of some health care workers who are using plastic bags as personal protective equipment. How widespread is that sort of problem?
Well, that's right, Tembegile. At this point, Nehawu was talking about Charlotte Maxeke, where they say that some of their workers had to use plastic bags. But we also have heard from a lot of health workers in the past, from the beginning of COVID-19. A lot of them have taken to media. They've spoken to TV. They've spoken to all sorts of media saying that there isn't enough PPE. But it's something that keeps coming back up. It's like a theme for the workers. Meanwhile, when you look at the top keeps saying that there is enough PPE. So just Nehawu was saying that there isn't enough PPE, and in the major 4 provinces that are now there, are seen as one of the epicenters, which is Eastern Cape, Western Cape, KwaZulu-Natal, and Gauteng, they have noted that there isn't enough PPE. So just basically reiterating what the workers have spoken about. But let's listen in.
An institution like Charlotte Maxeke at Johannesburg Academic Hospital, our team found that workers had to resort to using refuse bags to protect themselves. So they had to wear the plastics that are used for rubbish as part of protective clothing. The bottom line with regard to PPEs is that they were never adequate in the first place. The available PPEs are still not adequate in terms of what is experienced by our members at the institutional level and for the projected peak of the epidemic. especially when measured according to the requirements of the full complements of different categories of staff.
eNCA reporter Nqobile Madlala on that Nehawu briefing. Nqobile, thank you.